The refrain of the pandemic has been that no one is safe until everyone is safe.
Currently, the number of people around the world who are unvaccinated for COVID-19 is in the billions. And while the virus kills hundreds, sometimes thousands every day, U.S. President Joe Biden declared an end to the pandemic.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
Healthcare experts criticized Biden's assessment as premature, and they have the numbers to back it up. According to the World Health Organization, 75% of the population in high-income nations have been vaccinated, while in low-income countries, the vaccination rate is only 19%, and that number can be much lower. For instance, 8% in Mali and only 3% in Congo. This deadly disparity is also not limited to vaccines, as coronavirus tests and life-saving antiviral drugs are not equally available around the globe. Speaking at last week's UN General Assembly, the Director General of the WHO warned that when one country falls behind in combating the virus, we all do.
These inequities are not just a risk for those they affect directly. They are a risk for all of us. So closing them is essential if we're to truly end the pandemic.
So if low-income countries can't get vaccinations and tests, why don't they just make them? The big obstacle is patent rights. For 20 months, South Africa and India have fought with the UK, US, and Switzerland for an intellectual property waiver. In June, the World Trade Organization approved a partial waiver for vaccines, but it excludes the tests and treatments. The co-chair of the People's Vaccine Alliance, Max Lawson, said it is disgraceful that rich countries have prevented the WTO from delivering a meaningful agreement on vaccines and have dodged the responsibility to take action on treatments while people die without them. So while U.S. President Biden may have declared the COVID-19 pandemic over, it could be assumed he wasn't speaking for everyone.